The United States is facing a healthcare crisis. There are nearly 100 million people who don't have easy access to a primary care physician, and the problem is acute in rural areas and minority communities. But a new software platform hopes to bridge the gap and provide access to better care.
A rural physician in the middle of Missouri could ask for a surgeon or group of surgeons from multiple different locations.
People are living longer, and there aren't enough physicians to take care of them. With offices in Boston, London, and Beirut, Jared Eben says Proximie may make rural health centers better equipped for care.
Proximie is a browser-based software platform where a surgeon in one location and a surgeon anywhere else in the world can simply open up a computer or a tablet or a phone and can join a live surgery and interact with that.
Think of Proximie like video conferencing for doctors, only instead of seeing a talking head, doctors will see the surgical field as though they were in the room themselves.
There are already cameras that exist in operating rooms or cath labs or interventional radiology spaces. We can just tap into those. If those don't exist, then we can provide cameras.
In 2015, the Lancet Commission estimated that nearly 5 billion people lacked access to safe and affordable surgery. Dr. Nadine Haram dedicated her studies to help fix that problem. The result was Proximie.
So I've always been interested in innovation and that intersection of technology and healthcare.
While cameras in operating rooms aren't new, the Proximie system does a few things that are a little different.
The telepresence. That's that live in the moment and record it and put it into a library. Now we can take all of that audio and video that we've captured. We can run it through our algorithms to continue to improve patient care and productivity and address those workforce shortages. It's actually been really exciting to see how hospitals have adopted this technology.
Being sick is never fun, but it can be even more frustrating when there are few answers about a cause. Dr. Wendy Trubo says that's the case for many of her patients with chronic illness.
They've been ill for years, they've seen 10 to 30 doctors, they've been told that they're anxious or depressed, and they're continuing to decline, and they're looking for a different approach.
Dr. Trubo went through traditional training as a physician.
I went to Tufts Medical School and then did an OBGYN residency.
But today she heads up 5 Journeys, a functional medicine practice with her husband, Dr. Edward Levitan. Functional medicine is an approach to care that practitioners say focuses on the root causes of a patient's illness.
Functional medicine starts with the philosophy that your issues can be solved, right? So it's a totally different belief system than your headache needs Advil.
Patients can go to Trubo's Newton office for traditional primary care services, but in addition to the usual exam room, they will find a wellness room.
I can't get to know you in 15 minutes. So our typical intake is an hour, and our typical follow-up is 30 to 45 minutes, depending on the number of tests we run. This is our sauna bed. We do sauna therapy for patients who are looking for a higher level of detox because
practitioners look at gut health, physical health, and a patient's endocrine system to get to the root causes of any problems.
So this cutting-edge technology that you're using, what can you see from a couple vials of blood?
We often start with what's happening in your gut, and what's happening in your adrenals, and what's happening in your nutrient and mineral status. You can go down into the weeds of what do your genetics show for your risk of developing X, Y, and Z disease.
This may not be the next generation of medicine for everyone. Functional medicine does come at a price, and most traditional insurance plans don't cover these extensive tests. The reward of this model of care, Trubo says, is a deeper look at a patient's overall health.
This is such a sprawling conversation because there's so many things we can look at. And it's so cool, and people get better when you figure it out.
Doctors have recommended guidelines for preventative, for chronic, and for acute care.
Yeah, but according to a study by the Journal of General Internal Medicine, there aren't enough hours in the day to follow them. If American doctors were to follow all the guidelines, the journal says they'd need 27 hours in their workday,
They're
which
working
is
hard enough already.
Exactly.
Coming up, diversifying the tech space.